And then at the bottom of this report is the trial section. And that can be helpful because this can provide information about what clinical trials are available based on the molecular alteration that is found. In this report, this is reporting the different clinical trials that are available locally. So since I practice in San Diego, that's why we're seeing here the clinical trials that are located in the San Diego area. And that can be helpful to discuss with your medical oncologist when you're thinking about clinical trials, either in, upfront in the first, when you're starting therapy, or thinking about clinical trials when some of the initial therapies stop working. The other section that I wanted to go over that shows up in the molecular testing report is a section that will highlight mutations that fall under the category of variants of unknown significance. Basically, when we're performing sequencing of the tumor, we can pick up a lot of other molecular alterations, but there's a lot of alterations that we still don't know what the role is in cancer development and growth. And so for those alterations, they get listed they get listed under the category of variants of unknown significance. So while they're there, we don't quite have enough information about them at this point to know what their role or significance is. And as Dr. Marks had mentioned, as far as molecular testing in lung cancer goes, there's DNA and RNA sequencing. And for a lot of medical oncologists, we're now doing combination RNA and DNA sequencing because RNA sequencing can identify some gene fusions that DNA sequencing may miss. And so in the earlier report, I had reviewed a report for DNA sequencing, but if your medical provider orders an RNA sequencing, you might see that as part of the report. So just to make note that, as far as how we're identifying all of these molecular markers, there's a lot of different tests right now that are available to really try to find molecular targets in lung cancer.